Well, we also have some dramatic research tonight on another big issue with Obamacare, and that is the swelling Medicaid rolls. As state after state shows a huge surge in Medicaid applications, we pulled numbers from the nonpartisan Congressional Budget Office. They are estimating that by itself, Obamacare will add an extra 9 million people to the Medicaid rolls in just the first year, costing $21 billion more than we would have otherwise spent. By 2023, Medicaid's rolls will include 13 million more people at a cost of nearly $100 billion more than we'd be spending on Medicaid without Obamacare. Ellison Barber of the Washington Free Beacon has been looking into this problem. Ellison, good to see you. And so these numbers are actually pretty dramatic. If you look at the numbers of the people signing up so far, you and I talked about this the other day. Here are a couple examples. In Maryland so far, 96% of the folks who have signed up have been on Medicaid. In Oregon, 100% have been Medicaid. Washington State, 85% Medicaid. Kentucky, 80% Medicaid. All the people going on and signing on to these state exchanges are signing up for Medicaid, not for the exchange,
right,
the part that's supposed to fund everything.
Yeah, and we'll remember, too, that the administration pointed to the states as like, look, this is how we're having good enrollment. And clearly, if they're not enrolling in the exchanges, it's Medicaid. That undercuts the entire picture that they presented that the enrollment was being successful at the state level, because it wasn't. They were enrolling in an entirely different program, which is Medicaid.
And can you explain that? Because the way the Medicaid rules, okay, they wanted to get people on Medicaid who weren't otherwise insured, so we knew who they were, we could control costs. I get that. Yeah. But the people who are supposed to be signing up in these exchanges and paying money out of pocket, which you don't have to if it's Medicaid,
right,
their money was going to be used to do what?
That was going to pay for the entire program, essentially. I mean, if you don't have healthy people paying into the exchanges, then the entire system will collapse, because then you just have a high-risk pool of people who are sick paying into, and you have people in Medicaid that are free. And while those are separate programs, they still, when you look at it in terms of like the broader uninsured pool, that's three groups that you kind of have. You have your Medicaid eligible, then you have your high risk, and you have your healthy people. Anyone who's going into Medicaid is one less for the exchanges. Whether they would have been eligible for the exchanges or not, because they've expanded it, that's still opened the doors for more people to be in Medicaid and less healthy people paying into insurance, which is what they need for the law to succeed.
But now they say, look, these folks who are rushing onto these Medicaid rolls were already going to the hospital. They were getting sick. They were going in. They were running up our bill. So that was already something we were having to pay for. Now it's just out in the open, the numbers of them who there are, and the system is working exactly as they expected it to work.
Sure, I think a lot of states would disagree with that, though, because I think there are a lot of states that are worried in terms about the finances of this, where they haven't budgeted for having all of these extra millions of people in every single state. And states are a little bit different. The thing to remember about states is states are different than the federal government. Every state except for Vermont has a balanced budget provision, either in their state constitution or in their state statutes. So for Georgia example, where I'm from, they have a budget balance provision written in their constitution. So they cannot expand spending even if they want to. So to have to care for all these people in Medicaid now, when they haven't planned for it in their budget, they're either going to have to raise taxes, raise income payroll taxes, or cut things for other spendings like roads, schools, and things like that. So there are a lot of bigger problems that go with it. It's one of those ideas that it sounds nice to be like, there are a lot of people that still need insurance, so let's expand it to help people get on it for free who can pay for it. But there are real costs that come with it, and it's taxpayers. Yeah. Even in the states, even though, like we talked about the other day, 26 states have signed up for this, but it's federal money that's paying for the newly eligible people. That's everyone. If it's not in your state, you're still paying.
Right, so if you think you're fine because your state didn't sign up for this, and usually it's the Republican-run states that didn't sign up for that in the Democratic run, you're not fine because you're a federal taxpayer, and so you may have to pick up the excess. If they have a swelling of the Medicaid rolls and they don't get the money to pay for it from the exchanges, guess who's going to pay? Here's a hint. Here's a hint. Ready? All right, Ellison, thank you.
Thank you.